Hi, I am Dr. Deepa Rajendran. I am a consultant at Fortis, Richmond Town. Today's topic would be what to expect from each trimester during pregnancy. So we all know pregnancy is 9 months, and this 9 months is divided into 3 portions of 3 months each. The first 3 months is called the first trimester. Now during this first trimester, the expectant mother, the couple, when she misses her periods, does a urine pregnancy test either at home or at the hospital. The test comes positive. She ideally visits her gynecologist, and once she visits her gynecologist, there are certain questions that are asked to the expecting mother, and there are certain investigations also being done. Now the first thing is the expecting mother can experience vomiting sensation, she can have headache, excessive sleep, body pain, okay, increased urination. These are the common symptoms that are experienced in the first 3 months. During this time, your gynecologist would basically first examine you, make sure everything is fine. Because the body undergoes a lot of changes once you become pregnant. Not only hormonal changes, but physically the body also undergoes a lot of changes. After your initial examination, there is a basic ultrasound which is done in as a first visit to identify where the pregnancy is, followed by which certain basic investigations are done to make sure that your health condition is good to continue the pregnancy. Now after this, there are certain basic medications that could be prescribed to you, which are very good for the developing baby, and this is very important, especially when we consider the brain development of the baby. So a common medication that will be prescribed to all of you all would be the folic acid medication. After this, you may also be prescribed some anti-emetic tablets to prevent excessive vomiting. It's very important that the family members at this time support the pregnant lady, because during this time the woman experiences a lot of emotional changes due to the hormonal changes, and during this time she requires a lot of support, not only emotionally but also physically in terms of diet. Common question, what to eat? That is what everyone asks. In the first 3 months they are vomiting. What do I eat, doctor? We normally recommend to avoid any oily and greasy food, dry food like simple curd rice. This is what is easily available for you. Light food, even bread and jam. This is what we normally tell them to take. Small quantity, frequent meals. Even vegetables and fruits, whatever they are having. Avoid spicy food, boiled vegetables, fruits, yes, all whatever they like. Avoid citrus fruits because it increases the acidity and thereby further worsens the vomiting. Exercise during this first 3 months, yes, we do allow exercise, but it has to be supervised. We don't recommend excessive jumping. Normal walks as per their previous health status. If they are already an athlete, they are allowed to go for normal regular walks. All that is allowed. Hygiene is very important in this first 3 months and the entire pregnancy, because pregnancy itself there is a chance of developing a lot of infection. So hygiene is very important. Next comes the middle segment, which is the next 3 months, which is called the second trimester. During the second trimester, the expecting mother experiences new changes. She starts to feel her baby to kick. So that is a very emotional and a moment of bonding between the mother and the growing fetus. So this can occur anywhere around 4th month, between 4th and 5th month. And during this time, yes, the body nutrient requirement changes. You may start feeling more hungry. The vomiting sensation reduces, and so you feel more hungry, you want to eat a little more. It is all allowed as per your cultural background. Whatever your normal diet is, we say follow the same thing. Avoid spicy food and oily food, that's all. During this time, you will be visiting your doctor, where the doctor will be doing a few investigations, basic like checking for your sugar, and also your blood pressure will be monitored regularly. And also the 5th month anomaly scan is also done, which is important to see whether there is any anomaly which is incompatible with life. Following this enters the 3rd month, 3rd trimester. During this 3rd trimester, your visit to the doctor may increase. Your dietary changes according to various blood tests that you have done, whether you are diabetic or not diabetic, all of these changes, which you will be regularly counseled regarding that, whether you can eat this, you should not eat that. You will have a dietitian who will guide you along this entire process. Towards the end of the 3rd trimester, around the 8th month, your doctor will sit down with you and decide a birth plan. Okay, and as long as you don't have any complications, any high blood pressure or any diabetes, other placental complications, if all of that is not there, if everything is okay, your baby's condition, growth is good, they will discuss with you what is the birth plan. Okay, then also what to expect when the baby comes in terms of lactation, that is feeding of the baby, diet, contraception, everything will be discussed towards the end of the 8th month, on the starting of the 9th month. During this time also you will be undergoing a couple of ultrasound to make sure that the baby's growth is good, and overall your condition, your blood test, your urine test, all will be analyzed to make sure everything is good. And accordingly, once the birth plan is planned, you can discuss and go ahead further with the appropriate management. Thank you.